8 years old woman is discharged following fracture neck of the femur. On review, she is making good prognosis, but consideration is given to secondary prevention of further fracture. Unfortunately, the orthogeriatricians are all on the annual leave, and the consultant has asked you to arrange suitable management. So what is the best option? So that means a 78 years old woman suffering from femoral neck fracture, and after surgery the patient is discharged to home, and when she came for the follow-up, what should be given or what drug given to prevention of the secondary osteoporosis? So the secondary prevention of the osteoporosis, what drug can be given? Here the options are alendronate, calcium and vitamin D supplement, strontium, dexascan, and hormone replacement therapy. That means the HRT. So what may be the option? So first of all, let's see the osteoporosis. The osteoporosis in normal bone, here we can see this is the different part. First of all, outer it is the cortical part and medullary part, and here we can see this part, there the pore, and the pore is very small, and there is the huge level of calcium present. But in case of second picture, here we can see the calcium, they are mobilized from the bone and they are in the blood and finally goes outward. And in this picture also similarities, here we can see this area, these pores are continuous and there are huge amount of calcium, but in case of this picture here we can see they are broken down. That means calcium is mobilized from the bone in the blood. So now see the osteoporosis prevention, that means we have to reserve this calcium in bone. That means the amount of blood or the amount of calcium which goes from the bone, what we have to do, we have to restore the calcium. It is the primary treatment. So here we can see the bisphosphonate, calcium and vitamin D supplementation should be given all patients over the age of the 75 years. So here this 75 years is very important, that over the 75 years patient we should give all the patient calcium, vitamin D and bisphosphonate. We need calcium, but we are giving calcium, vitamin D and bisphosphonate. Why? Then here we can see the DEXA scan. This is another important investigation, and the DEXA scan is done in a patient which is below the 75 years. So when there is more than 75 years of the age, usually DEXA scan not required. We should give supplement calcium, vitamin D, also the bisphosphonate. But when there is below 75, in this case DEXA scan needed. Hormone replacement therapy is another option which prevents the osteoporosis, but there is a risk, the risk of cardiovascular disease and risk of breast carcinoma. So for these two important risk of carcinoma, we should avoid the hormone replacement therapy. So what is our option? Our option is the alendronate, calcium and vitamin D supplementation in this patient. The patient is 78 years old woman, that means more than 75, and in case of more than 75 years old age patient, we should not go for DEXA scan, we should go for the supplementation of calcium and vitamin D. First of all, let's see the calcium. Calcium directly goes to the blood and it deposited in the bones and prevent osteoporosis. On the other hand, the vitamin D, what is the role of the vitamin D? The role of the vitamin D actually what it does, it goes to the gastrointestinal tract. Here you can see this is a pose. So vitamin D goes to the gastrointestinal tract and it causes reabsorption of calcium and phosphate in the blood from the diet. So in the both form we can giving the calcium. That means when we giving oral calcium, it goes directly to blood. On the other hand, when we are giving the vitamin D, it goes to the gastrointestinal tract and the reabsorption of the calcium and the phosphate occurs, and calcium and phosphate they comes into the blood. For this condition, we should give calcium with vitamin D and also the alendronate. Thank you all.